Well, let's do a diagnostic game. I have some clues here for you. So we have a patient, a 13-year-old Hispanic boy. He has little or no friends. He enjoys solitary activities. He occasionally tries plastic, paper, or deodorant. He shuts down in unfamiliar setting or around strangers. He refuses to communicate when not feeling comfortable. He spends hours and hours building things like Legos. He fidgets regularly. He struggles with expressions. His mother said people don't get him. He concentrates only on certain tasks. So what's your initial diagnosis? Well, it could be Pica and autism spectrum disorder, right? And based on DSM-5 diagnosis criteria, actually right now is DSM-5-TR, is the persistent eating of non-nutritive, non-food substance. The duration has to be at least 1 month, and it has to be inappropriate to developmental levels, because we know that smaller children sometimes they just try non-food substance, just to try it out, the sand, the dirt, and whatnot, but at one point they stop, and it's not a part of culturally supported or socially normative practice. What are the examples of non-food substances? I have a list here for you, like chalk, cigarette butts, clay, clothing or thread, coins, dirt, feces, unfortunately, that happens, hair, large amount of ice, paint chips, that could be very dangerous, paper, plants or grass, plaster, that's also dangerous, rocks, pebbles, or wood chips. You have to be very careful with that because it could stuck in the throat. Rock salt, rubber bands, that's also very dangerous, shampoo and toys. Which one do you think is the most popular items? It could depend on the culture too, right? Common causes of pica, it could be a sensory feedback, automatic reinforcement, difficulty telling food from non-food items, low level of iron, zinc, or other vitamins. Pica is not usually caused by a lack of ability to communicate needs or an effort to gain attention, so we should not mistaken it for that. Pica in general population, it could be because they're pregnant, they have dementia, is a response to certain treatments, iron deficiency as we discussed earlier, or cultural and social influence. Pica in autism spectrum disorder population, behavioral rigidity, atypical sensory functioning, indiscriminate or generalized behavior, like items chosen are random or opportunistic, right? It could happen in this population. What do you think? What are other disorders commonly comorbid with pica? Yeah, it could be intellectual developmental disorder, schizophrenia, OCD, or obsessive compulsive disorder. Recommend treatments for pica, blocking, skill building, snack scheduling, teaching alternative behaviors, and you can see that these are behavioral modifications. It's not so much about the cognitive functioning, right? You just have to change the behavior, so it could be very straightforward. What else do you think caregivers should do or could do? How can we prevent that from happening? Thank you for your time. Let's think more about that, like what you can do to help your children.